Okay, so you get your blood work back and your doctor says, well, everything looks normal, but maybe you don't feel normal and you wonder, am I really getting the full picture of my health? Is there something missing here? Oftentimes there are hidden clues buried within your lab test results, and those numbers could reveal important insights about what's going on in your body, and specifically health clues that may be overlooked. Standard blood tests offer a bunch of information actually, but it's often easy to miss important details or overlook things. And today we're going to uncover 3 of the more commonly overlooked or missed blood test results that can help you get a little bit deeper understanding of your health and what's going on with your body. Hello and welcome. My name is Dr. Terranella, and this channel is all about helping you understand and optimize your health. Today we're going to be blood test detectives and help you uncover and better understand what's going on in your body. If you're liking these videos and getting a lot out of these videos, please hit that like and subscribe to continue getting videos like this. So here's the problem. You may rely on your doctor to interpret and understand what's going on in your blood tests for you. And while many doctors do a great job, oftentimes they are pressed for time. And so they may overlook certain things or only focus on the more obvious things that are highlighted in bold. And these individual markers and overall pattern of your blood work could be early warning signs of underlying health issues. It's kind of like reading a book, but only skimming through the headlines or the chapter titles. Yeah, you're going to kind of get the gist of things, but you may not get the more subtle nuanced things that could be going on. And so taking a more careful and deliberate look at your own blood work can help you identify potential health issues before they become more serious, so that you can take lifestyle actions like maybe dietary things or specific supplements or even exercise that's going to help your unique biochemistry steer away from a problem. Taking this more nuanced approach too can help you engage in more productive discussions and discovery with your doctor about what could be driving these so you can improve your health. And so as a doctor, I think we have to look at ourselves as almost like detectives, and we wouldn't really ignore obvious evidence or even subtle evidence. Actually, the contrary, we want to look at the more subtle things. Sometimes that's where you make the deepest connections in understanding what the underlying causes are for health issues. And so your blood tests are a key component of your overall case file. The blood tests often provide nice clues as to the underlying causes of what's going on if you look at them with a careful enough eye. And part of that is just looking beyond what the reference range is to what's more optimal for each specific test. And so that's one of the biggest obstacles. Really understanding the difference between what's optimal and what's normal can be really helpful in reading between the lines of your blood tests. Also looking at things in connection with one another, the labs as a whole versus each individual one, is going to give you a different understanding and start to produce a story around what's going on versus looking at each one in isolation. Okay, so if you made it this far in the video, you're probably thinking, oh, that sounds interesting. Tell me which blood test markers I can use to uncover what's going on with my health. And there's actually a lot to this question. So we're going to focus on 3 main areas in this video. And if you like this kind of information, we may go into multiple parts to this kind of nuanced look at blood tests. All right, so the first one we want to look at is the MCV. And I have done other videos on the MCV. And MCV is the mean corpuscular volume. So it's basically measuring this average size of your red blood cells. A corpuscle is a red blood cell, and it's a standard part of something called a CBC, or complete blood count. And when the MCV is high, you're said to have a macrocytic picture, large picture, and I would consider anything above maybe 93 to be slightly high. And the higher the levels, though, the more obvious there is a problem. The typical cutoff for a lab is going to be around 97 or 100. And so you can see if you're 95, that's not quite optimal, but it's not quite abnormal either. And so what is this telling you? Well, it could indicate a vitamin B12 deficiency, or it could also indicate a B9 deficiency. Both of these are really essential for making new red blood cells and creating DNA-based pairs, which is what you need to make new cells. Those aren't the only reasons why you can have larger than normal red blood cells, but those are the 2 most common reasons. And another common reason is chronic alcohol consumption. So even if you're only drinking a couple drinks 2 or 3 times a week, you may end up with higher than normal MCV values, especially if you're not supplementing or you're not consuming adequate amounts of these 2 crucial B vitamins. So the MCV, or size of the red blood cells, can also be quite small, and that would be called microcytic. This smaller than normal, smaller than average pattern of red blood cells suggests that there's something going on with iron, and we would typically consider anything below 85 to be a bit low, and the typical lab cutoff is going to be around 80. So this could be suggestive of just an iron deficiency, or it could be iron deficiency deficiency anemia. The difference there being if you actually don't have enough hemoglobin or enough red blood cells and you have the small size, that's a microcytic anemia, which is common for iron deficiency anemias. This can also happen with thalassemias. Thalassemia is a misshape of the hemoglobin molecule, which leads to more red blood cells, but much smaller ones. And there's also anemia of chronic disease, which sometimes presents as a normal size of the cell, and sometimes it can be microcytic as well, meaning in that less than 85 range. And in that case, it's where there's inflammation affecting the body, leading to storage of your iron in other parts of the body. So the red blood cells and bone marrow don't have access to enough iron. So you just start cranking out less of those red blood cells, and the ones that you do have are smaller in size. Lead poisoning also presents as a microcytic type of anemia, or just smaller red blood cells as well. So why is this often missed? Well, let's say you have an MCV of 95, and then the next time it's 96, and then the next time it's 94, then the next time it's 98. Over time, nothing's getting flagged on your lab tests, but it's always in that upper end of the range. And if you don't do any deeper investigation, it's basically just going to remain that way until you take a deeper look at some of these other things that could be an indication of maybe a B12 deficiency or folate deficiency or something else. So basically, this is a clue that you need to look a little bit more carefully at some of these other things to uncover what's going on. And that's going to allow your body to crank out the optimal amount of red blood cells, making sure your tissues get perfused with the right amount of oxygen, making sure metabolism is the way it should be, and on the extreme end, that you don't become anemic. So the second thing we want to look at is the triglyceride to HDL ratio. So this is part of a lipid panel, and it's a simple calculation. A triglyceride is partially carbohydrate and partially fat, and you're going to divide the triglyceride level, which is in milligrams per deciliter, by your HDL level. Your HDL cholesterol is your good cholesterol. In this calculation, this ratio of your triglyceride to HDL is a indication of your insulin resistance. And so when you have an elevated triglyceride HDL ratio, that means you have more than 2 or more than 3 triglycerides for every 1 HDL. And as we said, it's an indicator of insulin resistance when you have a high ratio, and it's even more predictive of heart disease in some studies than LDL cholesterol, but this could also be because it's connected with insulin resistance and diabetes, which also makes you at greater risk for having heart disease and strokes and heart attacks. So the ideal or optimal ratio for this is going to be 2 or less. So that means for every 2 triglycerides, you have at least 1 HDL to even out that ratio. Many times when you're looking at your lipid panel, you may only focus on the total cholesterol or only the LDL cholesterol. That's quote unquote the bad cholesterol. This information may get overlooked. That is the triglyceride to HDL ratio. And I think it's important, especially when you're trying to understand whether or not you have insulin resistance. But cholesterol itself should be looked at independent. The LDL and all these other markers should be looked at as well. But when you're trying to understand more nuanced things, the triglyceride to HDL ratio is sometimes overlooked or missed. And so you can imagine that you might have a normal A1C level or even optimal levels for those, but your triglyceride to HDL ratio is quite high. Well, that's telling you that there is an issue with insulin resistance in your body, and you want to be able to take action and improve that so that you don't end up with more problems with your blood sugar and insulin resistance down the road. The other thing is sometimes you have to calculate this on your own, and so you can imagine that someone has a triglyceride of about 135 milligrams per deciliter, and they might have an HDL of 45 milligrams per deciliter. Those two in and of themselves are normal, but when you look at that ratio, it's above 2, and that's where you might be showing some signs of insulin resistance. So the third one we want to take a look at is uric acid, and uric acid is a waste product from the breakdown of purines, which are basically the building blocks of DNA and RNA, and they're found mostly in animal-based proteins and animal-based foods. And when you have high levels of uric acid, it's classically associated with gout, but increasingly recognized also as a marker of metabolic syndrome. And it's been also linked with high blood pressure and even just being overweight. Uric acid can actually damage the kidneys, and there are specific kidney stones that you can get from high uric acid as well, but it can damage the kidneys independent of the stones. Uric acid is also a pro-inflammatory marker, so it's in our best interest to keep this uric acid in check. And a lot of times people may be familiar with uric acid and its association with gout, but sometimes we overlook the broader implications of elevated uric acid levels, even below the standard levels for gout. So for instance, ideal levels are going to be less than 5.5. And it's not just protein and animal-based products that are going to raise uric acid. Anything with fructose in it is also going to cause problems with elevated uric acid and potentially leading to gout. So the individual markers themselves should stand out and are important in understanding what's going on with your health, but it's the patterns and relationships between these markers and other things that they imply that's also important to recognize and understand. And so a high MCV in combination with a low B12 is strongly suggestive of a B12 deficiency. And a clear high triglyceride to HDL ratio is definitely going to be a red flag, but if glucose is normal, maybe it would be overlooked. Or if it's elevated, could be a stronger indication that, hey, we need to take a look at what's going on with your glucose. And so hopefully you're starting to get an idea of the more nuanced ways to look at some of these tests. And these are just a few of many different things that can give you these clues in your body. And you may be wondering, this all sounds great, but is there actually science to validate this? And the answer to that is yes, absolutely. There's lots of scientific literature looking at these three specific things and their importance in really understanding and optimizing your health over the long run. But it's not just about uncovering that clue. It's also following it over time to see if it resolves when you implement strategies to improve those numbers. So for instance, an elevated MCV, we said, is a fairly reliable marker of B12 or folate deficiency. And sometimes that's just a clue that you have a genetic alteration in folate metabolism or how your body handles B12. And low levels of MCV definitely suggest an iron deficiency, but you need to take the iron to repletion and improve your overall iron stores and see that MCV come up. That's taking it to its end to make sure you're getting the most out of that test and understanding the connection with your health. When it comes to uric acid, studies have clearly shown the link between elevated uric acid and increased risk for cardiovascular and metabolic issues, even kidney issues, even within what's traditionally considered to be a normal level. And so that's why we use more of the 5.5 range as an indicator of a potential problem there. Now, when it comes to the triglyceride to HDL ratio, there's lots of studies validating the importance of this ratio and its strong relationship with cardiovascular events. And these are in individuals with normal LDL cholesterol. Other research has shown that a triglyceride to HDL ratio of 3.5 or higher is strongly associated with insulin resistance, even in individuals with normal fasting glucose. And so in this case, they're using other testing methodologies to understand how much insulin resistance is present beyond just looking at the fasting glucose test. So hopefully this information kind of highlights the importance of being a little more proactive, being a little more engaged in the nuances of what's going on with your health, what's going on with your blood tests. And it's about understanding the difference between optimal ranges and what the lab reference ranges are, and recognizing different patterns and things, and considering the interconnectedness of the different things that are going on with your blood work. And if there's pieces missing to that puzzle, getting the follow-up pieces to make that connection. And so all this is great, and it's great to be informed and understand what's going on with your health, but that doesn't necessarily mean you need to go to medical school. And so it's crucial to work with a doctor to get more personalized guidance on each of these things. The general idea, the surface level idea is to, look at things more carefully, but it's hard to know all of the things that goes into analyzing each one of these tests. And so here's some tips on how to maximize the value of your blood tests. Number one is always get copies of your blood tests and keep a record over time. That way you can identify different trends and also compare the previous one to the new one. A lot of times labs will naturally do this for you these days, but not all of them do. If there's a pattern there and your doctor didn't tell you about it or didn't bring that up, don't be afraid to ask questions about the trends that are occurring and also what maybe dietary impacts could be having on some of the lab values that you have questions about that seem to be off. They should be able to at least point you in the right direction. Remember too that slightly abnormal levels aren't always an indicator of a serious problem. Sometimes things change in our labs and it's just a one-off, so we don't need to necessarily evaluate every single test result as if it's going to cause a life-threatening illness. But we also don't want to take a passive role and not understand what's going on. So striking that balance is what we're going for. So if you're interested in learning more about abnormal lab results and maybe you want a little more detail on each one of these, we do have a playlist on abnormal lab tests that you can check out, and you'll find more information on these types of things. So remember that your blood tests contain hidden clues about what's going on and how you can better understand your health. Things like MCV and the trends in that MCV can indicate vitamin deficiencies like B12 or maybe even a folate or iron problem. The triglyceride to HDL ratio is a powerful marker of insulin resistance, and its power is in watching it over time as you improve your health and improve your insulin resistance. Uric acid is also an important but kind of hidden marker for insulin resistance and overall metabolic issues. And following this can give you clues onto how you're doing with your overall metabolism and inflammation in general. Remember, don't just look at what the normal range is. You want to kind of find that optimal range. And not all tests have this optimal range, but the ones we covered here definitely do. And there are others that are important to consider. Remember, your blood tests aren't just static numbers. They're a window into what's going on in your body and understanding the signals that your body's giving you so that you can go beyond basic health into more optimal health. So hopefully this video gives you a better understanding of what many people miss on their blood test results. If you do have questions, please drop them in the comment section. But if you're looking for a more personalized, nuanced, and direct access to help you along your health journey, consider joining the membership program. Just click the join button below and you'll get access to more detailed answers to your questions and also early access to some videos. And you'll also be supporting this work. Now, one question you might have after watching this video is, what about the hemoglobin A1C test? Is that an accurate test? You can find more information on that in this video here. Thanks again for watching.